name is Dr. Alex Chung. Nowadays, a lot of patients require implants. In order to do an implant, there's several examinations we have to do. Number one is we need to do what we call a comprehensive oral examination. That includes panoramic x-ray and 3D CT, and it's likely we'll take some photograph of inside the mouth. But most importantly, what are the spaces that we need to make the restoration? Some teeth are so short, some teeth are very long, some bones are narrow, some bones are too short. There's a lot of things that we need to calculate before placing implant, because once the implant is put it in wrong place, the final restoration cannot be achieved. When we do dental examination, we look at for a couple of things. When we look at the CT, if we're putting implants on the upper part, there's a sinus. The sinus area, we need to know how much bone we have for the sinus. If we don't have enough bone, then we need to do a bone grafting. There's a different types of bone grafting to accommodate the size of the implants. So number one, we look at the length of the bone. The second thing is we also need to look for the width of the bone, because the implant size, smallest we have is 3.4 millimeter all the way to 7 millimeters. So in order to put 7 millimeter, we need to put at least 9 millimeter bone width. If we were to do 3.4 millimeter, then we need to have at least 4 or 5 millimeter width, because we need a 1 millimeter and 1 millimeter on each side of it. So the width is important and the length is important. A lot of people consider or concerned about having a bone density. The bone density of the jaw is very different than any other parts of our body. The upper jaw tends to be more softer, so we need to maintain, or we need to wait for 4 months for minimum healing. For the lower, because the bone has more blood vessels, then we could wait for 3 months. Upper one, we wait for 4 months. The lower one, we wait for 3 months. So if you're a good candidate, number one, health is important. Number two, making sure that you are cooperative. Other than that, everything will be fine. The age is not important. If you have a systemic problem that is controllable, then you're okay. A lot of times people thought if you're diabetic, then you couldn't do implants. Yes, we can do implants. We could do implants to most of all people as long as they could walk into my dental office.
请关注我们洛杉矶牙医俱乐部，以了解更多牙科资讯。